have fired a warning shot announcing a 14-day strike notice to protest against what they call a chaotic and poorly executed rollout of the Social Health Authority SHA. The unions have gone ahead to demand immediate action from the government, citing a lack of transparency, deteriorating healthcare services and fears of massive job losses in the health sector. Ann Odida with the details.
In a dramatic turn of events, a coalition of public service unions has fired the first salvo against the government, issuing a 14-day strike ultimatum over what they describe as a gross betrayal of workers' rights.
Should these concerns remain unaddressed within the next 14 days, starting today, all the unions here undersigned will proceed on industrial action without any further notice.
The SHA Act, it must be reviewed before anything happens. Failure to which in 14 days we are going to lobby 47 plus 48, all our workers right from anywhere.
At the heart of the unfolding crisis is the controversial rollout of the Social Health Authority, a transition that was supposed to usher in a new era of universal health coverage, but which instead has plunged the entire public workforce into uncertainty.
How they are going to implement the promise of UHC, yet one of the pillars of UHC is access to that healthcare, but they have denied the same.
It was unnecessary for them to launch SHA prematurely. Maybe the idea might have looked good on paper, but you know, the dynamics of the population in Kenya and where we are as a country, it was a terrible idea to prematurely launch SHA.
The promises were grand when the SHA was launched: more comprehensive healthcare for everyone, expanded coverage and a seamless experience for all contributors. But within days of its rollout, the lofty vision has begun to unravel with claims of a tangle of administrative blunders and ill-conceived policy decisions.
Then this is against the backdrop of increased taxation. You raise NHIF to almost 300% on the very payroll package that CBAs do not have the congruent increase or corresponding increase in terms of the income and take-home pay.
The unions are also sounding the alarm of a job security, warning that thousands of NHIF employees could be left jobless due to the premature SHA launch.
We are therefore demanding for an 100% transition of the jobs from NHIF to SHA without anyone losing their jobs.
As the deadline looms, the unions have demanded that all public service workers' benefits be reinstated under NHIF or given better alternatives under SHA. With no end to the stalemate in sight, the government faces the very real threat of yet another crippling nationwide strike, one that will no doubt paralyze the healthcare sector just months after the 3-month-long strike that put the nation to a standstill. Ann Odida, TV 47.
Thank you, Ann.